Okay, for the femur, we have a nice round head. Notice that there's a little depression inside the head of the femur for a little ligament there. That's for the attachment into the hip socket. That little hole is known as the fovea capitis. We have a nice neck, and then a large lump, which is the greater trochanter. There's a lesser trochanter too, which should be oriented posteriorly. So when you try this bone on, the head should be medial, the greater trochanter lateral, and then the lesser trochanter posterior. Next we have the distal surfaces, which if you've oriented your femur, you have a medial and a lateral condyle, just those smooth rocker surfaces that are going to allow your knee to hinge. Those are condyles, so those slightly superior, sticking out structures above it are the epicondyles. On the posterior surface of this bone, we have a couple structures. Below the lesser trochanter here is the gluteal tuberosity, just a rough surface on the top half of the posterior portion of the diaphysis. And then there's actually a line, and you can feel it with your finger. It's just a little tiny ridge of bone on the very back, known as the linea aspera.